Doctors usually tell you to cut back on sugar or take your medications properly to improve diabetes health, but they don't often go into detail about how much nutrients matter for people with diabetes. Without the right vitamins, insulin doesn't work as well, nerves get weaker, and complications can creep up faster. And here's the crazy part: most diabetics are low on these key nutrients without even realizing it. Do you ever feel tired all the time, deal with constant aches, or struggle to get your blood sugar under control no matter what you do? Chances are your body is missing something important. Fixing that gap could make a huge difference in how you feel and how well you manage your diabetes. Let's get into which nutrients matter most and how to make sure you're getting enough every day. If this helps, please subscribe to support our work. Let's start with the first one. Number 1. Vitamin B6. Most people don't think much about vitamin B6, but if you have diabetes, it's more important than you might realize. Your body loses B6 faster when blood sugar is high because your kidneys flush it out along with excess glucose. On top of that, inflammation and oxidative stress, both common with diabetes, push your body to use up more B6 for repairs. High insulin levels can also interfere with B6 metabolism, making it harder for your cells to use it properly. And to make things worse, certain medications like metformin and blood pressure drugs deplete B6 even more. This is why many diabetics end up low on B6 without knowing it. Here's the tricky part. A B6 deficiency doesn't always come with obvious symptoms. If you're feeling extra tired, struggling with brain fog, or dealing with mood swings, low B6 could be a factor. One of the biggest warning signs is nerve issues, tingling, burning, or numbness in your hands and feet. Muscle weakness or poor coordination can also show up, since B6 is key for nerve and muscle function. Other signs include dry, flaky, or irritated skin, frequent mouth sores, and a weaker immune system. In severe cases, low B6 can even lead to anemia, causing dizziness, pale skin, and shortness of breath. A B6 deficiency can affect multiple systems in the body. It plays a big role in fertility. Low levels can reduce testosterone and sperm quality in men, while in women, it can lead to irregular cycles and worse PMS symptoms. It also affects libido, since B6 helps regulate dopamine and serotonin, two key chemicals that control mood and energy. The nervous system relies on B6 for nerve repair and protection. Without it, nerve damage can worsen, increasing pain and slowing recovery. The kidneys also need B6 to fight inflammation. When levels drop, the risk of kidney complications goes up. Eye health can take a hit too. B6 helps protect the tiny blood vessels in the retina. Without enough, diabetic retinopathy can progress faster, leading to vision problems. The heart and blood vessels are also at risk. B6 helps lower homocysteine, an amino acid that can damage arteries and increase the chances of high blood pressure, heart attacks, and strokes. When B6 is low, blood vessels get stiffer, making circulation problems worse. On a cellular level, B6 is essential for glucose metabolism. It helps break down glycogen, the stored form of glucose, so energy is released steadily instead of spiking and crashing. Without enough B6, blood sugar becomes harder to manage, and insulin resistance can worsen. It's also critical for neurotransmitter production, which explains why low levels can lead to anxiety, mood swings, and depression. B6 is needed for hemoglobin production, which carries oxygen in the blood. Without it, cells don't get enough oxygen, leading to fatigue and slower healing. The best way to get enough B6 is through food. Chickpeas are one of the richest sources. Just 1 cup cooked covers about 55% of your daily needs. Beef liver is another powerhouse, giving around 50% per 3.5-ounce 100 g serving. Wild-caught salmon provides about 40% per 3.5-ounce portion, making it a great protein choice. Turkey delivers around 40% per 3.5 ounces, and sunflower seeds offer about 30% per 1 ounce 28 g serving. These foods don't just maintain B6 levels, they also support nerve, health, immunity, and metabolism, making them especially beneficial for diabetics. If you enjoy gourmet meals, some high-end dishes are packed with B6. A Japanese-style miso-glazed salmon with chickpea puree using 6 ounces of salmon and 1/2 cup of chickpeas delivers over 90% of your daily needs while supplying omega-3s for heart health. A French beef liver pâté with roasted garlic potatoes, 3.5 ounces of liver, and 1 medium potato provides around 85% of your daily B6, along with iron and B12 for better energy and red blood cell production. A Mediterranean chickpea and grilled lamb stew with saffron. 7 ounces of lamb and 1 cup of chickpeas delivers about 80% of your daily B6, while offering essential amino acids for muscle repair and immune support. If food isn't enough, supplements can help. The best forms of B6 come in bioavailable versions like P5, P, pyridoxal 5, phosphate, which your body can use immediately. Thorne Research P5P 33 milligrams per capsule is one top option. Pure Encapsulations Vitamin B6 50 milligrams per capsule is another excellent daily choice. Most diabetics do well with 25 to 50 milligrams per day. But if you're considering higher doses, it's best to check with your doctor. Some foods and habits can make a B6 deficiency worse. Refined grains like white bread and pasta lose most of their B6 during processing. Diets high in sugar burn through B6 faster. Alcohol interferes with absorption and increases breakdown in the liver. And medications like metformin, birth control pills, and blood pressure drugs can drain B6 over time. Replenishing B6 through food or supplements is essential. Vitamin B6 might not get much attention, but for diabetics, it's a game changer. It helps insulin work better, protects nerves, supports heart health, and keeps energy levels stable, making it one of the most important nutrients for managing diabetes. About 40% of your daily vitamin B6 can be found in a 3.5-ounce, 100 g serving of turkey, and sunflower seeds offer around 30% per 1-ounce, 28 g serving. These foods don't just help maintain B6 levels, they also support nerve health, immunity, and metabolism, making them especially beneficial for people with diabetes. If you enjoy gourmet meals, some high-end dishes are surprisingly rich in B6. For example, a Japanese-style miso-glazed salmon served with chickpea puree is both nutritious and delicious. Using 6 ounces, about 180 grams, of salmon and 1/2 cup of chickpeas, this dish delivers over 90% of your daily B6 needs while also supplying heart-healthy omega-3s. Another great option is a French beef liver pâté paired with roasted garlic potatoes. Just 3.5 ounces, 100 grams, of beef liver and 1 medium potato provide around 85% of your daily B6 needs. This dish also offers a boost of iron and vitamin B12, which are essential for better energy levels and red blood cell production. For Mediterranean cuisine lovers, a chickpea and grilled lamb stew seasoned with saffron is a hearty, nutrient-packed option. With 7 ounces, 200 grams of lamb, and 1 cup of chickpeas, this meal delivers about 80% of your daily vitamin B6, while also offering essential amino acids that support muscle repair and immune strength. If you're not able to meet your B6 needs through food alone, supplements can help. The best forms come in bioavailable versions like P5P or pyridoxal 5 primosphate, which your body can use immediately without extra conversion. One top quality option is Thorne Research P5P, which contains 33 milligrams per capsule and absorbs well to support nerve function. Another solid choice is Pure Encapsulations Vitamin B6, which delivers 50 milligrams per capsule and provides a consistent daily dose. Most people with diabetes do well with 25 to 50 milligrams of vitamin B6 per day. However, if you're considering higher doses, it's always a good idea to talk with your healthcare provider first. Certain foods and lifestyle habits can make a B6 deficiency worse. For example, refined grains like white bread and pasta lose most of their B6 content during processing, so it's better to stick with whole grains when possible. Diets high in sugar can also deplete B6 more quickly. That's because insulin spikes increase the body's demand for B6, especially during blood sugar crashes. Alcohol is another major factor. It interferes with B6 absorption and increases the breakdown of this vitamin in the liver. Additionally, Certain medications including birth control pills, metformin, commonly used for diabetes, and some blood pressure drug scan gradually drain B6 levels over time. All of this means that replenishing B6 through food or supplements is essential if you want to maintain optimal health. Vitamin B, the sixth of, may not get a lot of attention, but for people living with diabetes, it's a game changer. It helps insulin work better, protects nerves, supports heart health, and keeps energy levels more stable, making it one of the most important nutrients for overall diabetes management. Number 2. Vitamin E. Think of vitamin E as your body's natural shield protecting your cells, nerves, and blood vessels from damage. But here's the problem. People with diabetes burn through vitamin E faster than normal. High blood sugar increases oxidative stress, meaning your body has to use more vitamin E just to keep up and fight off cellular damage. Because vitamin E is fat-soluble, it needs healthy fats to be absorbed properly. Unfortunately, if you have diabetes, fat metabolism is often less efficient. This makes it even harder to maintain healthy levels of vitamin E. The tricky thing about a vitamin E deficiency is that it doesn't always show obvious signs. Early symptoms might include muscle weakness or trouble with coordination. That's because vitamin E is crucial for proper nerve function. When levels drop, communication between your nerves and muscles starts to break down, which can make neuropathy symptoms like tingling, burning, or numbness in your hands and feet feel much worse. If your skin feels dry, irritated, or is slow to heal, low vitamin E might be the cause. Vision issues such as trouble seeing at night or increased eye strain can also be early warning signs. That's because vitamin E helps protect the tiny blood vessels in your retina. If you're getting sick more often than usual, that's another clue, since this nutrient plays a key role in immune function. A vitamin E deficiency can impact nearly every system in your body. It affects fertility, as it's essential for healthy sperm and egg production. In men, low levels can reduce sperm quality, making conception more difficult. In women, it can disrupt hormone balance, leading to irregular cycles or even pregnancy complications. Libido can take a hit too, because vitamin E improves blood flow, which is essential for sexual health. The nervous system also suffers. Without enough vitamin E, nerve cells are more vulnerable to damage, and neuropathy symptoms become more intense. Kidneys are affected too, since oxidative stress is a major cause of kidney damage in people with diabetes. Vitamin E also protects the blood vessels in the retina, so vision loss can progress faster when levels are low. When it comes to heart health, vitamin E plays a powerful role. It helps keep arteries flexible, reduces inflammation, and prevents cholesterol from oxidizing. This reduces your risk of high blood pressure, heart disease, and circulation issue, all common complications of diabetes. Lowering the risk of heart disease and circulation issues is one of vitamin E's most important benefits. At a cellular level, vitamin E acts like armor, protecting your cells from oxidative stress. It helps stabilize cell membranes and preserves essential fats inside your cells, keeping your nerves, muscles, and blood vessels strong and functional. Another powerful benefit of vitamin E is that it improves insulin sensitivity. It does this by reducing inflammation and helping glucose move more effectively into your cells, which is especially critical for people with diabetes. Vitamin E also plays a key role in antioxidant regeneration. It helps restore other antioxidants like vitamin C, so your body's entire defense system stays stronger and more effective. When your body doesn't have enough vitamin E, your cells become weaker, more inflamed, and more vulnerable to damage. This accelerates the development of diabetes complications. Thankfully, there are many natural ways to boost your vitamin E levels through food. Sunflower seeds are one of the very best sources. Just 1 ounce, 28 grams, provides about 66% of your daily vitamin E requirement. Almonds are another great option, packing around 48% of the recommended daily intake per ounce. Hazelnuts are also beneficial, delivering about 28% per ounce. They make for an easy, heart-healthy snack that's high in antioxidants. If you prefer vegetables, cooked spinach is a solid choice. 1 cup of cooked spinach gives you approximately 20% of your daily vitamin E needs, Avocados are another excellent option. One medium avocado contains around 15% of your daily intake, plus the healthy fats needed to improve vitamin E absorption. If gourmet meals are your thing, there are some high-end dishes that also pack a vitamin E punch. A Mediterranean-style grilled sea base, topped with an almond herb crust, is both flavorful and rich in nutrients. Using 6 ounces, around 180 grams of fish, and 1/4 cup of almonds, this dish provides over 70% of your daily vitamin E needs. It also supplies heart-healthy omega-3 fatty acids. Another elegant choice is a Japanese-style roasted duck breast with a hazelnut miso glaze. With 7 ounces, 200 grams of duck, and 1/4 cup of hazelnuts, this dish offers about 65% of your daily vitamin E. It's rich in flavor and packed with powerful antioxidants. For something light but luxurious, a French avocado and sunflower seed tartare drizzled with truffle oil is both delicious and nutritious. With 5.3 ounces, 150 grams of avocado, and 2 tablespoons of sunflower seeds, this dish provides about 60% of your daily vitamin E in a beautifully balanced, nutrient-dense serving. If you're not getting enough from food, high-quality supplements can help. The best choice is natural vitamin E in the form of D-alpha tocopherol. This form is better absorbed than the synthetic version, which is often labeled as DL-alpha tocopherol. One top-quality product is Pure Encapsulations Vitamin E, which provides 400 IU per soft gel and comes in a bioavailable natural form. Another solid choice is Now Foods Vitamin E, also offering 400 IU per soft gel, with a balanced mix of tocopherols for broad-spectrum antioxidant support. Most people with diabetes do well with 200 to 400 IU of vitamin E per day. However, it's important not to go overboard. Excessive amounts can thin the blood, which might be dangerous especially if you're on medications that affect blood clotting. Always consult your healthcare provider before starting high-dose supplements. Certain foods and habits can actually make vitamin E deficiency worse. Processed vegetable oils like soybean and corn oil increase oxidative stress and can deplete your vitamin E stores over time. Diets high in refined carbohydrates and sugars also increase inflammation, causing your body to burn through more vitamin E to protect itself. Alcohol is another issue. It damages the liver, which reduces your ability to store and use vitamin E efficiently. Low-fat diets can also cause problems, since vitamin E requires healthy fats for proper absorption. Even how you cook your vegetables matters. Overcooking can destroy much of the vitamin E content. Light steaming or eating vegetables raw is best to preserve their nutrients. Vitamin E plays a massive role in protecting against diabetes complications, but most people have no idea they're running low. It helps insulin work better, protects your nerves, keeps your blood vessels flexible, and significantly reduces inflammation throughout the body. If your blood sugar has been harder to manage, your nerve pain has gotten worse, or your skin feels unusually dry or irritated, you might be low on vitamin E. Getting enough through whole foods or high-quality supplements can make a real difference. It improves circulation, boosts immune function, and makes your body more resilient against the everyday stress caused by diabetes. If this information helped you, please consider subscribing to support our work. We're here to make sure you have the tools and knowledge you need to stay healthy and in control of your life. Now let's move on to the third essential nutrient. Number 3. Vitamin C. Vitamin C isn't something most people think about, at least not until they're running low. But for people with diabetes, low vitamin C levels are more common than you'd expect. That's because high blood sugar burns through vitamin C more quickly than normal. Here's why. Both glucose and vitamin C use the same pathway to get into your cells. When there's too much sugar in the bloodstream, vitamin C can't enter the cells as easily. On top of that, diabetics face higher levels of oxidative stress, which increases the body's need for more vitamin C to fight off damage. And since vitamin C is water-soluble, it gets flushed out through frequent urination. That makes deficiency even worse. A lack of vitamin C doesn't always show obvious symptoms at first, but if you're feeling exhausted all the time, it might be because your cells aren't producing enough energy. Vitamin C is essential for that process. If you bruise easily or notice that small cuts and scrapes take forever to heal, it could be a sign your body isn't making enough collagen, which requires vitamin C. Vitamin C is crucial for many bodily functions, and a deficiency can show up in more ways than people realize. One of the first signs may be bleeding gums, which occur because vitamin C is essential for maintaining strong, healthy tissues. Dry skin is another early warning sign, as vitamin C plays a vital role in skin health. If you find yourself getting sick more often than usual, it could be because your immune system is struggling. Another sign you may be low on vitamin C. Joint pain and stiffness can also get worse when you're not getting enough. That's because vitamin C helps protect cartilage from breaking down, keeping your joints flexible and strong. In more severe cases, a vitamin C deficiency can lead to iron deficiency anemia. This can cause symptoms like dizziness, weakness, pale skin, and constant fatigue. But being low on vitamin C doesn't just make you feel sluggish. It can impact several major systems in your body. Fertility is one of them. In both men and women, low vitamin C levels can make it harder to conceive. That's because vitamin C protects reproductive cells from oxidative stress. In men, it helps with sperm production and motility. In women, it supports ovulation and helps balance hormones. So when vitamin C is low, conception becomes more difficult. Libido may also take a hit, since vitamin C supports healthy blood flow, something that's key for sexual function. The nervous system struggles without enough of it too. People with diabetes are already at higher risk of nerve damage, and without enough vitamin C, neuropathy symptoms can worsen. Your kidneys rely on vitamin C to help fight inflammation and oxidative stress. Without adequate levels, the risk of kidney disease increases. Eye health suffers as well. Vitamin C protects the tiny blood vessels in the retina, and low levels can speed up vision loss, especially in people with diabetes. But perhaps the most significant impact of a vitamin C deficiency is on the heart and blood vessels. Vitamin C helps keep arteries flexible, reduces inflammation, and prevents plaque buildup inside the blood vessels. Without enough, arteries stiffen, blood pressure rises, and the risk of heart disease and strokes goes up dramatically. On a cellular level, vitamin C acts as one of the body's most powerful antioxidants. It helps protect cells from the damage caused by high blood sugar and oxidative stress, common issues in diabetes. It also supports collagen production, which is critical for keeping blood vessels strong, skin healthy, and tissues able to repair themselves properly. On top of all that, vitamin C strengthens the immune system by helping white blood cells fight infections effectively. Another key role vitamin C plays is regenerating other antioxidants, like vitamin E. This keeps your entire defense system strong and more resilient. Without enough vitamin C, cells become inflamed, age faster, and function poorly. That can cause diabetes complications to develop more quickly. The good news is that getting enough vitamin C is relatively easy, through the right foods. Some of the best sources include kakadu plums, which are considered the most concentrated source of vitamin C on the planet. Just 3.5 ounces, 100 grams, provide over 3,000% of your daily requirement. Acerola cherries are another powerhouse, giving around 1,600% of the recommended daily value in just 3.5 ounces. Red bell peppers are more accessible and still pack a punch, offering about 200% of your daily needs per 3.5 ounces. Kiwis provide around 150%, and strawberries deliver about 90%, along with extra fiber to help regulate blood sugar levels. If you enjoy gourmet-style meals, there are high-end dishes that are loaded with vitamin C. For example, a tropical ceviche made with fresh kakadu plums, citrus-marinated salmon, and red bell peppers delivers over 2,000% of your daily needs in a single 5.3-ounce, 150-gram portion. A Japanese-inspired yuzu-infused tuna tartare with kiwi salsa offers over 1,000% of your daily intake in a 6.3-ounce, 180-gram serving. This dish provides a refreshing balance of acidity and umami flavor. For dessert, Try a French-style acerola cherry sorbet with dark chocolate shavings. A 4.2-ounce, 120-gram portion provides over 800% of your daily vitamin C requirements while satisfying sweet cravings without spiking blood sugar levels. If food alone isn't enough, supplements can help. But not all vitamin C supplements are created equal. Some forms are absorbed better than others. Liposomal vitamin C is one of the best options because it bypasses the digestive tract and enters the bloodstream more efficiently. One top recommendation is Live On Lab's liposomal vitamin C, which provides 1,000 milligrams per packet. It's a great choice for fast and effective absorption. Another solid option is Pure Encapsulation's ascorbic acid capsules, which deliver 1,000 milligrams of vitamin C per capsule in a straightforward bioavailable form. Most people with diabetes benefit from 500 to 1,000 milligrams of vitamin C per day. During illness or times of increased oxidative stress, higher doses may be especially helpful. But it's wise to check with your healthcare provider before increasing your intake too much. Keep in mind that some habits and foods can actually make a vitamin C deficiency worse. For instance, consuming too much sugar can block vitamin C from entering your cells. That's because glucose and vitamin C compete for the same transport pathways. A high-carb diet, therefore, makes it harder for your body to utilize vitamin C properly. Alcohol also depletes vitamin C stores while increasing oxidative stress. Cooking vegetables at high temperatures destroys much of the vitamin C they contain, so it's better to steam or eat them raw when possible. Smoking is another major issue. It rapidly burns through vitamin C stores, leaving the body low on antioxidants, and diets that rely heavily on processed foods, which lack fresh fruits and vegetables, make it harder to maintain stable vitamin C levels. Vitamin C is one of the easiest and most powerful ways to strengthen your immune system, improve insulin function, and protect your heart. It helps prevent serious complications like neuropathy, kidney disease, and vision loss. Whether you get it from food or high-quality supplements, making sure you have enough vitamin C can make a huge difference in how you feel and how well you manage diabetes. If you've been dealing with frequent infections, slow healing, or constant fatigue, low vitamin C could be part of the problem. Boosting your intake could be one of the simplest yet most effective steps you take toward better health. If you're feeling tired, dealing with nerve pain, or healing slowly, it might not just be aging, it could be a vitamin deficiency. Small changes, like adding nuts, leafy greens, or fresh fruits, can make a big difference in how you feel each day. Thanks for watching. If this helped, please like and subscribe. Take care, and remember, your health is in your hands.